My background, so I have a very unusual, very diverse background. I went to pharmacy school first because I always wanted to be a doctor, and I thought it'd be better to have a medical background than take liberal arts or something like that. So I went to pharmacy school, and then I became a podiatrist. I became board certified in foot and ankle surgery, and did a lot of reconstructive work. We used to put artificial joints in, do children with deformed feet, etc. But then I've done a lot of other things in sports and in medicine. I was a clinical instructor in medicine at Emory and did a lot of work with diabetics. Did a lot of work with athletes and sports performance, and founding fellow at American College of Rheumatology. So my background is very diversified, and it's given me a perspective to see medicine differently because I've subspecialized in so many different areas. My specialty now is high-end sports performance and arthritis, and people think, well, this is two totally different aspects. How do you combine them? But really, they're all related. My premise is really very simple. God didn't make us perfect, and we're not symmetrical. And any degree that we're off over a period of time is going to decrease our sports performance, increase our risk of injury, and later cause arthritic changes. So the very same premises that we use to increase sports performance and decrease injury, we use to prevent arthritis in people. For example, if you have a longer leg or a flattened foot, it's going to influence specifically how you perform and how your risk of injury is, and later it will cause you to have problems in your knees, your hips, your back, etc. So I'm on a mission really to change the thinking in sports. I think, and I don't want my passion for what I do and my belief in what I do to mislead anybody. I don't think that the work I do is a cure-all. I don't think it's an answer to every problem. I think that it's a very, very important, critically important missing link. I feel that what we do in sports to a large extent makes no sense from a starting point. If you want to play golf or play football, we basically, or tennis or any sport, we basically say, well, let's see what you got. Okay, you need to work on your backhand, or you need to rotate through your swing, and then we try to do things to increase your performance. And that makes sense. But what doesn't make sense to me is how can you possibly tell someone what to do, no matter how good a coach you are and how high a level an athlete you're working with, if you really don't know if they have a structural issue that may be preventing them from reaching the higher level of performance or maybe making them more prone to injury. So if I'm a right-handed quarterback and I have a longer left leg, I'll never be able to throw cross field as good as I can downfield because I'm trying to throw uphill on my left side. How can we teach someone without looking at the structural issues they may have? When I practiced medicine and did surgery, if you came to me and I gave you a prescription and I didn't examine you, you'd say, this guy's an idiot. He gave me a prescription, he didn't even examine me. How can we do that in sports? So my premise is that if we look at the structure of an athlete first and see things like a longer leg or a flattened foot again as examples, and we fix those things, then my goal is to simply give someone like Chris Hickson a better specimen to work with. What does that mean? We can take him to a much higher level, much faster, with much less chance of injury, and keep him at that level for a longer period of time. And I frankly don't see that done anywhere. Chris and I got hooked up. Someone told me that he was a great quarterback coach and that he had a lot of kids that were having problems and that I should give him a call. And I called him and we met. And one of the great things about Chris is he's an out-of-the-box thinker. There's no ego. He doesn't think that he can fix everything no more than I think I can fix everything. And when I explained to him what my premise was and I demonstrated it both on him and many of his athletes, he was quite amazed at the difference in what we could do. And so he realized early on how powerful that would be to work together doing that. So I think there are so many aspects to this. Obviously there are facilities that have elaborate training facilities with all kinds of sophisticated things. But again, I don't find that anywhere you look that athletes would be able to get the care and evaluation that we offer by working together. Starting with evaluating an individual and being able to tell whether they have structural abnormalities that are going to cause problems, as we've talked about, is one issue. I find Chris to be very, very unusual. What do we say the cliche is in sports? We don't care how much you know until we know how much you care, right? You don't find anybody that knows more and cares more than Chris Hickson. This is a guy that's super compassionate. When people come to the facility that we work at together, they're going to get individualized care. They're not going to be seen by somebody else. I mentioned to you before we started the interview, my wife goes to a top ophthalmologist, but when she makes the appointment, she doesn't see him. She sees an underling. That doesn't happen when Chris and I work together. Somebody wants to see about structural evaluation, they see me. They don't see somebody that's my associate. Someone comes to Chris, they see Chris. It's very personalized attention, and you're dealing with a guy that really, really cares. A devout Christian, a caring guy. This is somebody who really, really wants to help kids, reach their highest level of achievement. And that's above and beyond how much he knows about specifically teaching them. And then we have other people involved, like Bronson Walters, who's a genius with muscle. He's a kinesiotherapist. I work the base and stabilize the base from the bottom up. Bronson is an expert in determining whether you have a muscle imbalance that will make you much more prone to injury. He's an expert in telling you what exercises to do to equalize that imbalance, again, to prevent injury and to help you perform at a much higher level. It's freaky how much we don't learn in medical school. I've seen Bronson evaluate people with a leg length difference and manipulate their scapula and fix their leg length. Freaky. Amazing. But the difference in how these people perform is day and night. Look how important balance is in sports. Balance is defined as the equal distribution weight side to side against what? A vertical axis. My premise is that no one has a perfectly vertical axis because we're not born perfect and we're not born symmetrical. So when you fix the base and you fix the muscle imbalances and then you give that specimen to Chris to work with, now already you're starting way ahead of the curve. And that's why he can take people to a higher level faster with less chance of injury. In the old days we used to talk about the tremendous degree of rotation that Tiger Woods had when he swung a golf club. Where does that come from? That 360 comes from a vertical axis. And nobody can throw a football as well as somebody who throws a football who's more balanced, more stable, more aligned. And we just don't seem to do that. We think by buying the latest pair of shoes and sticking them on somebody that we've taken care of the foot. I often refer to the foot as the orphan appendage. In our average lifetime, we walk 4 times around the surface of the earth. And imagine driving a car with tires or wheels in poor alignment 4 times around the surface of the earth. You'd be riding on the frame. But we don't think anything of that. And yet when we develop a problem in our knee or a hip, we say, well, it's due to overuse, or it's due to age. You asked me earlier about arthritis, and we're taught as physicians that osteoarthritis is due to age. Live long enough, we're all going to get it. And that's another thing that really makes no sense to me. People have had one knee or one hip replaced. Is their other knee or hip any younger? No. Is it carrying any less weight? No. Doesn't even make sense, but we're quick to say that it's due to age. Are age and weight factors? Absolutely they're factors, but they're factors secondary to malalignment. So if somebody has perfectly equal leg lengths and their feet are straight and there's less friction on the joints, they can go for a longer period of time. Much like driving a car where the wheels and tires are balanced and aligned, you get longer wear, more even wear, and a better ride. But when somebody develops pain in the knee or hip, we say, oh, of course, you played football or you have arthritis. No one is really looking at the why, at the cause. And I think what Chris and I and Bronson and others have that's unique is that I think we're the only facility that takes all of this into consideration and allows us to produce a level of athletes that's much higher with much less injury.